any kind of planning or policy or strategy with regard to human resources for health. Dr. Amal has actually paved the way for this presentation, giving ample information about what we're faced with our human resources in Sudan. And I've already shared that in many occasions, that in Sudan we're bleeding human resources for health, both internally and externally. Because we produce human resources, masses of human resources, but yet we do not see that reflected or translated in our health system, especially the private sector, the public sector. So we need to work together today and find solutions given the context of Sudan, which is very complex context, to move forward. So my presentation will have, I'm going to skip the situation or the current situation of our human resources, because Dr. Amal has given a quite vivid picture of the status in Sudan. I will go through just identifying or give you an kind of idea, what is the National Health Workforce Account? And what is it for you all as stakeholders in that workforce account? If it is operating, what do I get out of it as a stakeholder in the human resources realm? As well as giving every stakeholder an idea of their areas of action or their cues for action, so that we can make the human resources in Sudan sustainable and their distribution equitable, because a person in North Darfur, a person in the northern state, a person in Sinnar should have the same quality of care and should have access to that quality of care. So my presentation will be National Health Workforce Account towards Sustainable Human Resources for Health in Sudan, which is a prelude for and showing how the National Health Workforce Account, its operation can serve the whole strategy and the whole direction of the Human Resources Directorate in its conquest of managing human resources in Sudan. So I will skip the area of the situation, but I will just give you an idea of my content in the presentation. What is it? Why NWHA? We give it the acronym NWHA. It's a National Health Workforce Account. And how can the human resources stakeholders benefit from it and from its operation fully? What has been achieved so far and what is needed to fully and full-fledgedly operationalize the account, and what is the way forward? We're going to go from there. The objective is to show the role of the National Health Workforce Account in supporting the health system, build consensus around the support of the NWHA, what is needed from each stakeholder for the functions and the activities to flow through. Attain the commitment towards the NWHA, because it comes as no surprise that we start things well, but the sustainability of things is the key, that we have to really have the commitment and the conviction to keep it going. And then we give a holistic view of the Human Resources Development Directorate and its approach towards Sudan's human resources management through its policies and strategies. So, of course, we are situated in the third Sustainable Development Goal 3, which is good health and well-being for everyone. Especially the C part, which has been confirmed and has been affirmed by the WHO, the World Health Organization, that in order for us to attain the universal health coverage, which will actually lead to giving good health and well-being to everyone around the world, for all us 8 billion around the world, is through sustainable, skilled, empowered human resources for health. NWHA is a specialized health information system, just to put it simply. It is an HRHIS, which is a human resources system, built on the notion of the health labor market framework. And NWHA is a data hub. So, for example, if the UNICEF need to know how many human resources have been vaccinated by the COVID-19, they will need the numbers. These numbers have them, the National Health Workforce Account, easily can be at a click at their hand. They can know how many are there, where are they distributed, who has been or have been vaccinated and who haven't. So for any entity here, represented here, to get their plans going, and their plan has an element of human resources, they need the numbers from the account. It's just like your bank account. If you want to buy a car, if you don't know you have the resources for that, you wouldn't be able to do it, or you will go bankrupt. At least you will actually make a fun of yourself in front of the car dealer, right? So this is what we're trying to do. And NWHA represents a pivotal aspect for the 2030 because it has been guided by, in 2016, when the World Health Assembly has recognized that the human resources need to be supported, need to be strengthened in order for the Sustainable Developmental Goal 3 to be attained by all countries. So the health system in Sudan is undermined by consecutive natural and man-made disasters, as Dr. Amal said, and it disrupts the operation and exhausts the human resources, mainly human resources for health in Sudan. So why the health labor market? Why we are doing that? Because as I mentioned earlier, that the National Health Workforce Account is built around the framework for the health labor market analysis, because the health labor market analysis gives us a vivid picture of the dynamics of the labor market based on 4 elements working together, mainly the production, the inflow, who gets into medical school, nursing school, midwifery, and wants to become a healthcare worker, and who gets out, either retirement or death or etc. And also the distribution, the inefficiencies, the maldistribution, the disequilibriumed skill mix, as Dr. Amal said, all of that working, and our governance of the private sector, these all work together. And the 4th element is the dynamic between them, is also shown in this framework, as you can see. So that's why I need to build my National Health Workforce Account and most of the strategy on this dynamic, because it shows where are the things, where is the education sector, the dynamics, who enters the workforce and who exits the workforce, and what should be done, and where are the policies, where are the points for intervention to actually do the equilibrium and pull the strings so that we have perfect governance or semi-perfect governance of our human resources. For example, the education sector, the Ministry of Higher Education, you have 80 colleges producing human resources, and I am inundated with them So in order for the state of Khartoum prepare itself for these people when they get out, so that they can be trained, because the training, not only the facility, but the curriculum and the trainers themselves. And we know that we have mass immigration of the skilled and capable HRH. So these people, if they're immigrated, then who is going to train the new generations coming into to the field? So I need to know the numbers before I can inform and coordinate. The key word is coordinate and collaborate with the Ministry of Health, the Ministry of Higher Education to fix the pipeline and give me the alarm. It's like, this year, there are so and so have been accepted. So I need how many nurses, how many midwives to create the perfect skill mix for the doctors and for everybody who is becoming who are pharmacists and dentists and whatsoever. I'm actually skewed towards dentistry because by profession I am a dentist. In dentistry we have a problem of not having enough dental assistants. We do not have enough dental operation personnel. And Sudan has very high numbers of oral cancer and other related oral diseases that require not only the dentist, because he cannot be the medical worker in everything. We need dental allied personnel. We need pharmacy technicians. So all of these workers and all of these human resources that we do not see in the picture, we need to plan for it. That's why we are following this framework to normalize and optimize these dynamics. This is also the modules for the NWHA based on the health labor market analysis. There are 10 modules, one under the education. For ease, there are 3 main domains, which is education, labor force, and serving population needs. Here we have the education training, education and train regulation and association. I need to break the golden rule of I am looking, for example, in Sudan, we're going to find like a perfect doctor or like a competent practitioner. And then they look at where did they graduate from? Where is their training? We have to break this cycle. That is how, by standardizing education. A person who graduates from Kassala University should be like the one who graduates from a Jazeera University, should be the same level of competency as the graduate from Khartoum University. That to be broken, and to give the empowerment and to give the confidence of all our graduates, we need to standardize that. So all the numbers, I have in this module, I will have the curricula, I will bring the experts so they can actually standardize the education, even the admission, the criteria for admission. Who is the medical doctor? Who is the pharmacist? Who is the doctor or the physician? So all of these are under this module. Then we have the labor force, which is the Ministry of Health, taking care of who are working, the stock, where are they at, their distribution, their areas of work. Also, we have the employment characteristics and the working conditions, as well as workforce spending and remuneration. The third domain is the population and health needs, which is skill mix composition. We need skill mix composition that is representative of the health status of the community so that we can offer patient-centered care. Then the governance, which is mainly by the Federal Ministry of Health and all state health human resources development directorates. And then the health workforce information system. This is where we are situated. The selection of indicators, then we have the education. We have many indicators pertaining to the health workforce account. There are 78 of them. But for ease, we need to select them and then put them under these domains. For example, the application of education, I've already spoke about that. Also, the CPD is very important, of course, because unless you continue or the workforce continues to know what the new technologies, what the new guidelines by the WHO, what is the new trainings and the new packages, they cannot face any emergency competently and optimally. And we have seen that when COVID had hit the world. Suddenly, all countries, if you are a first world or second world or third world country, it didn't matter because human resources were not ready. They were not ready. They didn't see it coming. So we need the training enough to make our workforce effective in its mission. Also, the labor force, the graduates, when they are starting, within a year, within 6 months, and so on and so forth, the exit rate of the workers from the force measures to prevent attack, because I need to protect my human resources. And we've seen that in COVID. Many human resources have been hit hard. We lost many of them. And some of them even under the pressure and the mental stress they've been through, they've just changed profession. So they exited the workforce. Serving the population, mechanisms to coordinate the workforce. This is what we're doing here, actually. And the health workforce planning processes, education plans should be aligned with the national health strategy and the national human resources for health strategy, and of course, human resources information systems. The World Health Organization has incorporated the establishment of NWHA in its strategy for 2030 to support and empower the countries to optimize their health workforce management to attain the universal health coverage and formulate conducive national health human resources for health strategies. NWHA gives a vivid picture of the human resources and allows the rapid response. It furnishes the required evidence for planning, policy development, and decision-making, thereby supporting the national human resources for health strategy locally for us in 2022-2024 and the long-term one 2030. It facilitates the interoperability, which is when the account is formed and fully operationalized, I get information from different stakeholders, and they are able to see what other stakeholders, what are their numbers, so they can coordinate their work, they can collaborate, they can identify areas for collaboration and areas for also to maximize the effect of their intervention and the effect of their mechanisms and strategies as well. It also supports the optimization and improvement of the human capacity and performance. What do all of you as stakeholders benefit from that? I've already mentioned that, but we can go through it again. It can identify the current gaps. I can see where are the problems with my health workforce. Is it education? Is it training facilities? Is it trainers? Is it the remuneration is not enough? The why are they immigrating? Why are they, as Dr. Amal mentioned, centralized in Khartoum? It is a no-brainer because in Khartoum we have a lot of facilities, and it's the most urban area in Sudan. So we have to know, we have to get the numbers and to get the information so we can understand what is going on. Supports and informs the intersectoral policy dialogue. For example, if I want to speak with any entity that is involved in the human resources development, I have to have a ground for my communication with them. It reveals information gaps and helps the prioritization of the research agenda, as Dr. Amal mentioned. It allows the comparability of information. For example, I can compare the human resources status in different states, all of the 18 states, as well as with the neighboring countries, regionally and internationally. Here is Sudan's governing stakeholders conceptual framework. It's pretty elaborate, but we will give each one of you later a printed copy of it so that it can help each stakeholder know where they're situated and their area of influence easily. This is just, as they say, that a picture is worth 1,000 words. So this is information and this is data. It helps the human resources create policy and make decisions that are accurate and that are compatible with the situation, the context, given the information they have. What has been achieved? We have done, given the circumstances and the context, the Human Resources Department has walked the hard walk and moved forward towards achieving a national health workforce account and creating a national health workforce account that is capable of optimizing our human resources for health. First, it started in the last forum with the endorsement of the operational frame and the action plan of NWHA, the development of the data sources map and the data collection and management plan that would be shared to your emails later. Full operation of the National Human Resources of Health Observatory and the recruitment of competent and adequate observatory staff to support all the operations and activities related to NWHA. The labor market analysis exercise has already been initiated and is actually going on, and it's supposed to be concluded very soon. Once it's concluded, we can share all the data with the different stakeholders so they can see the dynamics and what is happening between the health workforce and the labor market. Also, the activation of 14 state observatories. Now we have 14 health observatories activated around Sudan, and soon to be 18. We did not count the Khartoum state. Sorry, it did not happen, so I'm going to use this one. We have activated those 14 states, and we did not include Khartoum state. If we included it, it would be 15 states. We have other 3 states that will definitely be activated shortly. These are, okay. So what is needed from all of you? What we need at NWHA, at the National Health, Human Resources for Health Observatory, we're the home of NWHA. We will need full commitment of stakeholders. The Human Resources Development Directorate needs the full commitment of stakeholders, and coming together here is actually very, very exciting to us, and it shows your true commitment and interest in that. Timely allocation and mobilization of resources, because we need resources, human resources, financial, to support the operation of the national account. Also, we need to formulate new or amend the existing stakeholders' guidelines and SOPs to match the National Observatory for Human Resources as well as the NWHA. The agreement on fixed time, as Dr. Imad said, that the forum has always been held in timely manner before the disruption that happened after the ensuing of COVID and the unrest that the country is facing. It has been agreed upon that 4 times a year, every 3 months, the Human Resources for Health Forum convenes to discuss all issues related to HRH in Sudan. Also, a collaboration of stakeholders in planning and policy units with that of the Human Resources Department. So each human health information unit and policy unit at the different levels of stakeholders need to coordinate and actively have a communication plan, and so that we can exchange ideas, exchange information easily. The capacity building of the observatory, either the national and the state observatory staff, and we've already collaborated with the WHO for getting or formulating a training session for all the staff so that they can take on their duties effectively and competently. Then we have the NWHA pilot. It would be in 8 states, representing all parts of Sudan and all zones of Sudan. And if we get, if we're optimistic that we will hit 10, but not to be very optimistic about it and just promise something that might or might not happen, we said that they're going to be first, it would be 8 states. Then we have the NWHA dashboard. We've already built, written the concept note and agreed with the WHO team to give us the technical support required for the dashboard operation. The dashboard will help every one of the stakeholders to see the status of our human resources, who is entering the school, who are entering the colleges, who are exiting, who are entering the labor force, where they're situated, and gives us the trends of the labor market interacting with the workforce that has been produced. Also, we have the activation of the National Observatory website, which is very helpful in exchanging the information and giving access to all stakeholders to what's happening with the Human Resources Development Directorate. We have the resumption of the Observatory, which is a small, or it's a concise magazine or a news, much more than a newsletter, but we're aiming to become a magazine that will share all that is related to the human resources for health information. These are the resources, and I conclude my presentation with that. Thank you so much for listening and showing the commitment and the dedication to the human resources for health on behalf of the National Health Human Resources for Health Observatory team. We thank you very much.
Thank you, Dr. Safa, for the presentation that highlights what is the NWHA, its roles, the expectations, and the most important part is where our stakeholders will see themselves. Sorry for my colleagues who are not speaking Arabic. I will go here for Arabic and I will come back to you. بالنسبة لنا الحسابات الوطنية للموارد البشرية الدور كبير جدا وأساسي لشركاء الموارد البشرية الصحية. If you can bring back السلايد اللي فيها الأدوار. Yes. Thank you so much. بالنسبة لنا في وزارة الصحة الاتحادية الإدارة العامة لتنمية الموارد البشرية عندنا صورة مكتملة ومعلومة مكتملة عن الكوادر البشرية الصحية في السودان بمختلف الفئات على مختلف المستويات لتقديم الخدمة وتواجد الكادر البشري. لما نقول الكادر البشري بنبدأ من مستوى المجتمع لحد ما نصل إلى يعني المستشفيات المتخصصة. فبنتكلم عن إنه الصورة دي ما بتكون متاحة لوزارة الصحة الاتحادية بالكمال والاكتمال دي إلا إنه كل شركائنا بتاعين الموارد البشرية الصحية واللي هم موجودين على الخارطة دي يكونوا عندهم الالتزام والاعتراف بأهمية المعلومة دي، وبالتالي يعني يرفضوا النظام بتاعنا ده أو يدخلوا في النظام بتاعنا ده المعلومات المطلوبة عن الفئات المختلفة. What did you do? Okay, I will keep. فإحنا عندنا الثري chapters أو الثلاثة جزئيات اللي تكلمت عنها دكتورة صفاء. عندنا في الجزء الأولاني اللي هي المسميه الإنتاجية، يعني الكوادر البشرية والإنتاجية حقتها. بنلقى فيها عدد من الستيك هولدرز هم ما وزارة الصحة، عندنا وزارة التعليم العالي، عندنا المجالس المعنية بتنظيم المهنة، عندنا فيها بعض المعلومات اللي بتشارك فيها وزارة التعليم العالي مع الجامعات في إنه والله التكلفة بتاعة إنتاج الكادر البشري سواء كان طبيب أو غير طبيب بتكلف كم. فالمعلومة دي ما موجودة في وزارة الصحة، لكن هي is very important يعني for us. واللي ده برجعني للسؤال بتاع دكتور محمد في إنه والله يعني عشان أنا to start يعني policy dialogue مع وزارة التعليم العالي أنا بكون محتاجة المعلومات دي. هم بينتجوا كم عشان أنا لما تكون مكتملة الصورة عندي بكون عرفت الحوجة بتاعتي للسودان أنا محتاج كم لل10 سنوات القادمة، لل20 سنة القادمة من ياتو فئات، وكل فئة أنا محتاج منها كم ومحتاج وين. واللي هو ده الإكسرسايز اللي أنا في وزارة الصحة ما حقدر أعمله بشكل مكتمل ألس إنه الصورة دي تكون كل يعني الشركاء يعني غزوا النظام بالمعلومات اللي عندهم عشان أنا تكون بقت عندي صورة كاملة بتقدر تخليني أعمل إسقاطات للموارد البشرية، أحدد والله النظام الصحي في السودان عشان يقدم الخدمة على المستويات الأربعة محتاج كم ومحتاج وين وبياته كفاءات. فالحاجة دي عشان أنا to lead a very strong policy dialogue مع whoever stakeholder مع أي من شركاء الموارد البشرية وأصل لمخرجات تعالج التحديات دي زي ما تفضل دكتور محمد، عشان أنا تو أبروتش التعليم العالي وأقول لهم والله أنتوا قاعدين تنتجوا من 84 كلية حق الطب 9000 ولا 6000. السؤال الأساسي اللي حيرجعوا لي أنت دايرة كم؟ السودان محتاج كم؟ فأنا عشان أجاوب على السؤال بتاع السودان محتاج كم لازم الصورة الكبيرة دي تكون بقت مكتملة عندي عشان أنا أعرف على مستوى المجتمع أنا محتاج كم، محتاج منه ومحتاج منهم كم، وفي الرعاية الصحية الأساسية الأولية محتاج منه ومحتاج منهم كم عشان يقدموا أي نوع من الخدمات، وهكذا للمستشفيات الثانوية وهكذا للمستشفيات الثالثية وغيرها. لما تكون دي مكتملة عندي أنا بقدر زي ما قالت الدكتورة صفاء بيكون بقد عندي المعلومة مكتملة، أنا داير كم وعارف التعليم العالي بينتج كم والخلل المشكله يعني عدم الانسجام ما بين المعلومتين. فبيمكنني إنه والله very strongly لأن I have evidence in my hand و I have a meaning for those numbers. الأرقام دي عندها معنى إنه أنا والله محتاج كذا وأنتوا بتنتجوا كذا، حقتي عندها معنى مترجمة في خدمات حتقدم للمواطن وواضح إنها حتلعب ياتو دور في تغيير وتحسين المؤشرات الصحية. وحقة التعليم العالي واضح إنه والله دي أرقام it means what في سوق العمل، يعني إذا كانت كوادر طبية ولا كوادر صحية ولا كوادر ياتو نوع. فيبقى عشان أنا to lead a very strong productive وproductive دي مهمة شديد policy dialogue مع different stakeholder بكون محتاجة إنه الحسابات الوطنية للموارد البشرية الصحية حقتي تكون بقت فعالة وفعلا بتنتج تقارير إحصائية ذات معنى وقيمة في أنا والله أترجمها لنقاشات مع الشركاء المعنيين في كل المحطات بتاعة الكادر البشري عشان أنا أقدر أحسن من الوضع. فإتس نوت أونلي وزارة التعليم العالي، لكن أنا ممكن أصل لمرحلة إنه والله توافقنا في الإنتاج والإنتاج يعني موازي أو متوائم مع الحوجة بتاعة النظام الصحي. I take the same pieces وأمشي أتفاوض بها وتناقش بها مع ناس المالية مع ناس وزارة العمل ديوان الخدمة دايرين وظائف بشكلها كيف ممكن نتناقش مع حكومات الولايات في إنه والله الوركينج كونديشن عشان أنا والله الإكزات نيدد نمبر يكون موجود وساتيسفايد وهابي تو ورك محتاجين 1 2 3. فلما نقول والله الحسابات الوطنية وإحنا بنقول it's always beyond numbers إنه والله إحنا ما بنكون إحنا ما جارين ورا إنه يكون عندنا أرقام نقول والله السودان فيه 172 ألف كادر، فيهم 7,000 أخصائي، فيهم 3,000 أخصائي. إيه؟ No. This is not the idea. الأرقام دي لازم يكون عندها معنى، والمعنى ده بيجي من إنه والله to translate it into policy dialogues, policies, interventions, measures that really support correcting the picture. فبس انا حبيت ارجع الناس للصوره دي لانه الصوره دي اهم حاجه في البرزنتيشن بتاع صفازو، انه كله is very important لكن this is the most important part of it. انه والله احنا كستيك هولدرز sharing و shouldering الريسبونسبيلتي دي we need to see ourselves احنا وين. الحاجه الثانيه الاساسيه اللي ذكرتها دكتوره صفاء انه والله الحسابات الوطنيه للموارد البشريه ما حتكون حكر فقط لوزاره الصحه، هي وين وين سيتويشن. يعني لما انا امتلك المعلومه يعني متكامله ويكون عندي functioning يعني NWHA health workforce account definitely وزاره التعليم العالي they will have access to this. وزاره الصحه ولايه الخرطوم they have access to this. وزاره العمل they will have access to this لانه بالنسبه لهم الصوره الكليه ويشوفوا هم وين موجودين في الصوره دي it will answer lots of their questions وبالتالي حساعدهم ان هم internally to look into and to review and to revisit البوليسيز حقتهم الاستراتيجيات حقتهم الآليات حقتهم everything that can really at the end of the day support us في الموارد البشرية في وزارة الصحة الاتحادية انه to correct the pictures and to have the human resources that we need. You can correct me عمادي if I'm wrong. في الموارد البشرية احنا بنقول we need to have the right health workforce, the right number with the right capacities at the right time providing the right services. فدي ده الالتيميت جول بتاعنا. اوكي واللي هو ده يعني التشاركيه فيه حتكون بانه والله sharing what we have in terms of information. الحاجه الثالثه والاخيره اللي هي يمكن صفاء ما ذكرتها بشكل واضح لكن انه when we have a functioning health workforce account احنا يعني حنساعد بعض لانه التعليم العالي اذا عنده ايشوز في انه والله المعلومات يعني يدخلها في السيستم كيف الكباسيتي بتاعت الناس الهاندلينج الانفورميشن what pieces of information they have I mean data they have احنا ممكن نتشارك ونتساعد في انه to build up الكباسيتيز بتاعت ال different institutes. ليه؟ لانه في الاخر it will serve our goal. لانه لما يكون وحدة أو يعني المسؤول أو الإدارة المعنية عن المعلومات في الستيك هولدر انستيتيوت المعين عندهم إشكالية أو لا هم they are very strong و competent و they are functioning very well it will serve my goal. فأنا guess إنه دي يعني واحدة من الأشياء اللي يعني أنا حبيت to stress it يعني زي إنه دكتورة صفاء she already covered everything. I guess now the floor is for the questions. ممكن ناخد like 4 questions if possible بعد ذاك to go for the labor market analysis exercise.
Any kind of planning